Sydney was interesting in many ways because Sydney's also a health and wellness coach. She's a yoga teacher. So if you think of the 4 pillars of health being nutrition, exercise, stress management, and sleep, Sydney was about as good as you could get with respect to nutrition, stress management, and exercise. And so, and she was working at all these things before we kind of went on to this airway journey. She was working with yoga. She studied in India twice. She has an Ayurvedic teacher in Manhattan. And so we were trying kind of all these wellness tools to see if she could overcome anxiety and just not feeling energetic. Never once do I ever remember waking up and asking Sydney, "Hey, Sydney, how did you sleep last night?" Where she said, "I slept great. I feel well rested." It was always, "I never slept well." And so the inability to get a good night's sleep impacts the whole person. And depending upon what your Achilles heel is, it may impact some kids with learning disorders. Others might be behavioral issues. Others may develop anxiety problems, depression, and as they get older, blood pressure issues, cardiovascular disease, Alzheimer's, dementia. So you're compensating well until you're no longer compensating well, and then all of a sudden, here's a medicine in a bottle. And so let's see if we can learn more early on. And so this craniofacial complex, basically the nose and the mouth and the structures behind, we kind of routinely think of them. It's for breathing, but of course then we start to layer it. So breathing is then related to sleep. And sometimes it's exaggerated. So if you have a breathing disorder during the day, at nighttime when you go into some of the deeper stages of sleep and your muscles completely relax, that breathing issue is exaggerated. Digestion is part of the oral cavity is the beginning of digestion, but it's also, if we put the right things, it's beginning of nutrition, which feeds every organ in our body and every cell. You're in the world of speech, which we think of as lay people. Speech is articulation, but of course I know more, and it's behavior issues, and it's learning issues, and it's cognition, and of course if you're not sleeping well, boy, is that affected. And then in dentistry, there's the social and aesthetic of a pretty smile and pretty teeth affecting self-esteem, and there's sensory issues, and there's immune support that comes from breathing through the nose. And the truth of the matter is this idea of this connection. It's called the connection? I love the name that you selected, Michelle. What's it called? Of the seminar today. It's called Critical Connections. And the point is that, while Dr. Park is an ENT and Dr. Siegel's an oral surgeon, and your speech language pathologists and OTs, we need each other, and we're working on humans. And Sydney's that human that needs for us to identify. Because I had Sydney, at the time, I did not do orthodontics, and I took Sydney for orthodontics starting at age 8. And she saw 3 different orthodontists between age 8 and 18. I took her to Madison Avenue, who I thought was the best. And not one person along those lines said anything that her structural issues could be related to airway, breathing disorders, allergies to her dog, none of this. They were straightening teeth. And so I want us to be out of our silos and recognize we are in an interdisciplinary world, and to help our patients, we need to do what you all are doing here today, which is learning from others that are outside of your field. So Michelle asked that I talk just briefly about structures, and it is important to just kind of put it in a context, but the nose is for breathing, and the mouth is for smiling, articulation, digestion. But we get it confused, and more people are breathing through their mouth than are breathing through their nose. And as Dr. Park's going to touch on, it's an environmental thing that's happened over the last 450 years, and it's affecting our bodies in a profound way. But when air flows through the nose, it's coming, the top here is called the nasopharynx, then you have the oropharynx, which is behind the soft palate and the tongue, and then it flows into the trachea, which is the beginning of the lower airway. The key about airway disorders is they're very dissimilar. And it depends where, and I'm talking about obstructive airway disorders, because there's airway disorders that come from the brain that we call central sleep disorders. And it's when the brain doesn't tell the diaphragm to contract and relax, which is inspiration and expiration. But obstructive disorders are that anywhere along that pathway that there's something that interferes with the flow of air. And from the front picture, I mean, everybody kind of knows there can be tonsils that are touching. That would obviously interfere with air. On the back here are adenoids at the back of the nasal cavity, and if those are inflamed, it can interfere with the flow of air. If the nose is congested because of allergies or deviated septum, or these turbinates, which are these conch-like shells that have epithelium and mucus to trap bacteria and filter the air, if they get overgrown, the flow of air through the nose can be obstructed. And you can have it at the soft palate. The soft palate can be too far back, so if the whole maxilla, instead of advancing through growth and development forward, doesn't advance enough, then it means that the soft palate will be too close to the posterior pharyngeal wall. So when Dr. Siegel and Lisa Palladino speak about the importance of breastfeeding, that function of the tongue against the palate is the beginning of stimulating the forward growth of the maxilla. And to the extent that breastfeeding doesn't happen, missing probably the most important development aspect of creating an open airway. If the maxilla doesn't grow forward, typically the mandible gets trapped behind it and it doesn't come forward, and then the tongue is too far back relative to the pharyngeal wall. There's also lingual tonsils here. And so all those areas of obstruction, the nose, the soft palate, the tongue, the back of the tongue, and the epiglottis, any one or two or three or four can be obstructed in a person and create turbulence to the airflow. And this, we're not going to get into the math of it, but it's a really critical law called Poussel's law. And basically, it's about the flow of fluid, and it includes air through a tube. And so our airway is a tube. It has an opening at the nose and in the mouth, but it's a tube that goes and ends into the lungs. If you constrict the tube, you're going to have to require more inspiratory pressure. You're going to have to breathe harder to get that same volume of air in. But the crazy thing is, it's to the power of 4. And so here, a 19% increase in the radius will double the volume flow rate, meaning if the airway is bigger by just a little bit, it's to the 4th power. So any decrease in the size of the radius of the airway will decrease the flow of air and cause you to have to increase your effort to get air in. So, pregnancy, put on weight, very common to have obstructive airway disorders during that period of time, because just a small change in the radius of that airway can totally impact sleep. So then let's add on if you had 4 bicuspids extracted as part of an orthodontic experience, which should never ever happen, and it's still being taught that way in every dental orthodontic program in America and mostly throughout the world. Because when you take out 4 teeth, you're pulling the maxilla and mandible back, and you're trapping the tongue back. And so all these little layers of events, how about throwing on allergies? Allergies to dust, allergies to dogs, because we've moved inside. We used to live outside, and so we have many more. Our foods are changed and manufactured. And so all these little things are adding on to make our airway narrower and more obstructed. And so, and then at nighttime, we lay down. And so all those structures with gravity fall back. And so now the tongue is falling back to the back of the nasopharynx. And on the right side, you can kind of see how that obstruction can happen there. The soft palate can fall. And during REM sleep, the muscles completely become paralyzed. So gravity is going to happen to all of us. And so you could be on the edge of airway obstruction, and then as you go into deep sleep, you do obstruct. And so that's what the etiology is of sleep disorders. But we step back, and they're really airway disorders that are getting magnified by the event of going to sleep. And then on top of that is the airway is not this lead-lined tube. You know, the trachea is lined by cartilage and is not collapsible. But the oropharynx, the nasopharynx, oropharynx, and hypopharynx, all of that area behind the nose, soft palate, and tongue to the epiglottis is surrounded by muscle. And so to the degree that you have muscle laxity or excessive fat, that also can affect the airway. And so, you know, there's exercises to increase pharyngeal tone, which can help keep the airway open. And then this last piece, in dentistry, it's so misunderstood. I don't think 1% of dentists even have this concept that I'm going to give to you,